did kill Tim.
So as I said, good afternoon and welcome to the future home of an exciting space at Assiniboine College. My name is Derek Turner. I am the Vice President of Advancement at the college, and I will be your MC for this afternoon. And thank you all for coming. It's been a long time since we've been able to gather like this and have such a great crowd for what will be a fantastic announcement this afternoon. Before we get going, it's important to take a moment and acknowledge the land where we stand. And we're privileged for today's event, and we're very fortunate to provide learning outcomes. I'd like to invite our Director of Indigenous Education at the college, Chris Desjardins, to come forward with a welcome. Chris.
Thanks, Derek. Conche Kiwel, Chris Desjardins, Dishnakashin, Brandon Dochin. It's good to be with all of you today on the lands of the Dakota Oyate, shared with the Anishinaabe and the national homeland of the Red River Métis Nation. And I'm always excited to be part of these openings, these exciting announcements, and the programs that we're going to be introducing are much needed. And I come from northern Manitoba. I think some of the most exciting work we do as a college is the work we do in community. And we're graduating a lot of practical nurses that are being graduated at home in their communities. And I know in Cross Lake, Pimachikamak, and Norway House, both of them have one of them has a hospital, the other has a health center, and these are much needed training and program opportunities that are going to be staffed by their people. So I'm glad that we're going to be part of that journey with them, and thank you for all for you being here today. Miigwech.
Thank you, Chris, for the welcome and the opportunity to reflect. This is indeed a really exciting day for the college, but most importantly for the province, as we introduce you to this new space on the brink of transformation. We are pleased to recognize and welcome many dignitaries that are with us today. And first of all, I'd like to start with the Honorable Renée Cable, just sitting down in front of me, Minister of Advanced Education and Training. And I think I saw Glenn Smart just come in. He's our MLA for the college. We also have MLA for Spruce Woods, Colleen Robbins, that's sitting just right down here, right beside His Worship, Jeff Fawcett. So we'd like to thank you and your counselors for coming here today. We appreciate all of you for making the time and effort. Finally, I'd also like to acknowledge Trina Slate, who will be coming up later on today, the CEO of Prairie Mountain Health. We really appreciate your time and effort to come here today. And also, I would like to acknowledge our Board of Governor and Foundation representatives, as well as our members of our campaign cabinet that are going to help to activate this space in the coming months. So thank you to everyone that's made the time and effort to come out today and hear a very exciting announcement. To begin with, though, I would like to welcome Mark Frison, our president of Assiniboine College, to come and say a few words. It's Frison.
Yeah, you're okay. He's only worked for me for 15 years. It's okay. You get it. I've been very fortunate over the course of my career to have been involved in healthcare in a volunteer capacity. And when I was in Cape Breton, I was the treasurer of the Cape Breton Regional Hospital Foundation, helping to raise money for the things they were doing, including getting their first MRI. In Saskatchewan, I was on the board of the Saskatchewan Cancer Agency, which operates there like it does here, like its own separate health region. And here, I was fortunate to be on the board of Prairie Mountain Health for a while, including as its chair for a little while during the beginning of the pandemic. And, you know, one of the things I think about health here is it does take a lot of public comment. And in general, I'm one of the people who has a lot of confidence in our healthcare system. I think the work that folks do every day is good work. It's a complex system. And I think that they deserve a lot of kudos. Does it have areas where there can be continuous improvement? Absolutely. And I think they know that. You know, when I was on the board of Prairie Mountain, we knew we needed more anesthesiologists. I don't know if that's still an issue. We wanted a family doctor for everyone. We wanted to decrease our reliance on agency nurses. We wanted more paramedics, a variety of things. But I'll tell you, when we announced this program, it hits in a different way. Michelle Sykes, who's running the program, I know she's here, I just cut her eye. She often quotes that in the industry they say that 70 to 80% of the decisions made in healthcare are based on some form of diagnostic test. And I got to tell you, the first time I heard that, it really caught my attention. I had to think about it, and I had to play with it a little while. But you can imagine what that means for healthcare. And so you can see why there's been so much chatter. We have actually an interest list of people who want to take the program that's over 650 people. You know, you're not even able to apply to it yet, but there's 650 people who already say they want to take it. That's unprecedented in my time in post-secondary. And further, the number of places I go where folks mention that they were at the hospital or saw a doctor and they talk about the fact that this program is coming is amazing. So it certainly has captivated the larger healthcare community as well as the audience of future healthcare workers. You know, in terms of making a project of this substantial nature go forward, it takes some cash. And I'd like to thank the minister who, you know, the province committed $9 million to help make this happen. Our board is investing $10 million. That's an unprecedented level of equity investment from our board in any project, but they're putting in $10 million to make this happen. And in addition to that, we're going to try to raise from the community another $5 million, and we know the community's been very good to us on similar projects, and so we're very hopeful about that. In doing that, we've asked some people to help us out. And, Derek mentioned this in remarks. So last week at the Chamber, we announced who those folks would be, and that included Carrie Oriot, who's going to step up and be our chair. You know, Carrie came to know the institution, I think, well when his daughter Olivia actually worked for Dr. Rex, our Vice President Academic, as a researcher. And she's gone on actually to have a fairly substantial career with the Council of Ontario Universities in higher education policy and advocacy. But Carrie as well also has a deep background in healthcare, having been the lead fundraiser on the Murray House project here in Brandon, as well as being on the Canadian Friends of Rambam, a hospital in Israel. So Carrie, I appreciate you really stepping up there. In addition, Jennifer Ludwig, the president of the Chamber from Super Thrifty Drugs, is joining us. Diane Fotheringham has agreed to help out, and she's actually agreeing, I think, as well to step onto our foundation board. So it's a twofer. Nasir Malik from Assiniboine Credit Union, Jody Parsonage, who's also a member of our Board of Governors, and usually we have at least one member from the board who likes to participate, so we're very pleased to see that, and Michelle Gerard, who's on our foundation board and is also involved with Nipawa Home Hardware. And I think as folks pointed out, the programs we're going to offer here, while they'll have a tremendous impact both locally, will have a tremendous impact across the region, especially the combined X-ray medical lab technology, so I appreciate that. I've been with colleges now for 22 years, and before that I spent a little bit of time with government. And one of the reasons why I was anxious to leave government was not enough of my colleagues had a sense of urgency. They weren't always keen to do things on time, and I think some of you know I've been critical about that, probably even when I've been here, like as recently even as maybe last Thursday at the Chamber of Commerce. I can tell you on this particular project, the government has no lack of sense of urgency. There is no time when I talk to Minister Cable in person or on the phone, when she, including 10 minutes ago, when she doesn't ask, can you get it done faster? Where are you at? Are you sure you're going to complete it on time? But could you also get it done faster? And so, Minister, I want to thank you for that. Like I like being on the other side of the sword for a change. And, I've certainly conveyed that to our folks that government's keen to see this happen. The healthcare system needs these folks, and we got to do everything we can to make sure it happens on time. Appreciate everybody coming out and to help us celebrate this wonderful event. Thank you.
Thank you very much, Mark. I would now like to call on the Honourable Renée Cable, Minister of Education, Advanced Education and Training for the Province of Manitoba, to say a few words.
Thank you so much. Thank you for the gracious words. Usually people say not the same thing that they say in private, in public. So I am going to just hope that you say the same thing in private. Thank you so much, everyone, for being here. Chris, I've lost your face. Thank you for the wonderful land acknowledgement and for always centering events and making sure that we remember as a community whose land we stand on and our obligations to one another. Minister Smooth, Nice to see you on the hometown. For those of you that I haven't had the opportunity to meet in person, my name is Renée Cable. I have the privilege of being the Minister of Advanced Education and Training, and I am a proud Wheat King. Born and raised in Brandon, my family is still here. I have grandparents who are still with us. So, you know, as much as this is a phenomenal Assiniboine College announcement, and it is a phenomenal healthcare announcement, for me at this moment, it is incredibly personal. And I want to know that regardless of where an individual lives, whether it's in the Paw, Thompson, Verdon, Carmen, that people have access to the kind of healthcare that they need and that they deserve. And so I know that often conversations about healthcare happen in the confines of the Department of Health. But as a government, we were elected with the promise to help fix healthcare. And that doesn't just happen in ERs. It doesn't just happen in family doctors' offices. It happens here. So thank you to the college for being such a phenomenal partner and for answering the calls when I say, can we get it done? Are we almost there? What do we got going on? And for having the faith in us to follow through on it. We know that there's a lot to do in healthcare. And it is a bit of a perfect storm. A lot of things happened. A lot of decisions were made in the past that weren't the best for our communities. And we are doing all we can to help fix that. So it's programs like this with the combined lab and x-ray tech, all of the nurses that you're training in all corners of the province. We have people, healthcare aides. We have people training up in healthcare all across the province, from Altona to Churchill. And we are not doing it. It's folks like Assiniboine College, like Red River College, University of Manitoba, Brandon University. It is a project that everybody is working on, and I'm just so grateful to have such phenomenal partners here, and more so for the young people in this city. When I was growing up, one of the things that when you were leaving high school was how far away from Brandon can you get? And you know, like I went to New York, and I love that people have the opportunity to build whatever roots they want here. We're fixing up Brody, going to train more doctors here. There are big things happening here that have always been happening, but now you have folks, it's not, just so you know, it's not just Glenn who is the voice for Westman. There are a lot of us that make sure that you're not forgotten in the confines of the perimeter over there, because you really are the foundation of this phenomenal province that we live in. So I just want to thank everybody again for making this happen. I will probably check in every 2 weeks to see how it's going. And I can't wait to put the first class through and be able to reap the benefits of this. Thanks so much.
Thank you, Minister Cable, for the sincerity of your comments. We really appreciate that. We have a lot of work to do. In fact, I almost just tripped on a drainage grate as I walked over here. We're in a heavy-duty shop, if you hadn't noticed that at one time. Finally, I'd like to ask Trina Slate to come forward to say a few words. Trina is the CEO of Prairie Mountain Health, and we're honored that she's been able to join us today and share a few words. Trina.
Good afternoon, everyone. It's an honor to be here. It's just so exciting to be here to acknowledge an important milestone in healthcare education and workforce development right here in Brandon. The creation of the new medical lab tech and combined, I say CXLT, the combined laboratory X-ray technology program. space at Assiniboine College represents a significant investment in the future of healthcare across our region and across the province and in rural Manitoba specifically. For those of you who might not be aware, the CXLT program specifically serves rural facilities. We cannot operate an emergency department without nurses, without trained lab and x-ray personnel and physicians. We need those three things to be able to keep our emergency departments open in rural Manitoba. And so this is a significant investment and improvement for us. And we look very much forward to seeing the first graduates come through. These programs are more than just education. They're about keeping healthcare strong in our rural communities and First Nation communities, as Chris pointed out. Every day, our hospitals and clinics rely on diagnostic imaging professionals to provide timely, accurate results to guide patient care. As the need for these skills continues to grow, programs like this are essential to supporting a steady workforce of well-trained professionals who will support our communities now into the future. You may not be aware that Prairie Mountain Health actually doesn't oversee lab and x-ray services in the health system. It's actually Shared Health, and we do have the CEO of Shared Health here today, Chris Tadulo, and a number of leaders for the lab and diagnostic services program at Shared Health. Assiniboine College has long been a vital partner in this work. By offering high-quality training close to home, the college plays an instrumental role in attracting students to rural Manitoba, supporting them through education and helping them stay in our region after graduation. A shameless plug for Prairie Mountain Health. We enjoy a strong working relationship with Assiniboine College. We meet regularly with their executive team and nursing leadership team, and now we'll be meeting also, I'm sure, with these program leads as we work through this to ensure that the programming and services that the college offers is adaptive and responsive to the needs, recruitment needs of the healthcare system. We know that training locally, and as does the college, is one of the most effective strategies to recruitment and retaining healthcare professionals in rural areas. And the college continues to lead the way in making sure that that happens. On behalf of Prairie Mountain Health and Shared Health, if you don't mind, Chris, I want to thank the college, its leadership, faculty, and industry partners for their commitment to strengthening the healthcare workforce. This new learning space is not just an investment in facilities, it's also an investment in people, in communities, and in the long-term health and well-being of the region and the province. Congratulations on this exciting development. We look forward to continuing our strong partnership for many years to come. Thank you.
Thank you, Trina. As I said, we're really excited to be in this space today. We're also happy to have Shared Health represented here today, so thank you for taking the time. Assiniboine's commitment to being a provincial leader on healthcare training front, as well as furthering our goal to work with our provincial partners on improved healthcare outcomes for all regions in the province. We really look forward to working together on developing the new space as we continue to move forward on the medical laboratory technology program and the combined laboratory and x-ray technology programs. Those students should be with us. They will be with us in September of 2027. So stay tuned as we move along on this project. Thank you all for coming today.